Okay, today the topic is kemiringan panggul anterior. So we're going to be talking about basically technical terms, we call it scoliosis. So you can see on this picture here, scoliosis is basically kemiringan panggul anterior. So what happens is that some people are born with it, some people have this because of trauma. Let's say they were a child and playing around, fell down and started to have kemiringan panggul. In both cases, the solution should be the same, because if the person is already, let's say person is older, there's a difficulty to treat it for sure. Because if we treat it when you're older, let's say you're 40 plus, it becomes much more difficult to treat because the bone is already solidified, the bone has become mature. Now, the younger you are, the easier it is to treat. How do we treat scoliosis? In my clinic, we do a few things. First of all, we do traction. So we have a specialized table which does traction, it kind of pulls the bones apart. Number two, we do specialized manipulation treatment. It's called adjustment. So we actually take the spine and we manipulate it back into the right position. And the third treatment is we reduce the inflammation and we improve the function of the muscles and the nerves. So what I'm trying to say is that it's quite possible to improve kemiringan panggul anterior. It's still possible to improve. Yes, it takes time. It's not very instant. It might take a few weeks or a few months in some cases. But the improvement is quite visible. Most of my patients that have scoliosis, they improve usually within a few weeks. You're going to see quite a lot of change. So what's the first step? First step is you have to get examined to make sure we know where it's coming from. One of the causes that could be happening is that you could have inflammation or injury in that area. So inflammation and injury, and that's why you became Miring, that's much easier to fix. If you have something that's inborn, like you're born with scoliosis, that's actually much more difficult to fix. It takes time, and the earlier you start, the better it is. So if you start when you're a teenager, for example, it's easier to fix it than, let's say, if you're 20, 30, 40 years old. If you have associated pain together with the kemiringan panggul, in my clinic, pain is reduced usually within 4 to maybe up to 8 visits. People have lots of improvement of pain. So if you have pain, let us know if you have a question, write it down here in WhatsApp, or post a comment in social media. Okay, thank you for watching.